video of the winner. Congrats to Boston Children's. Many of you know about the Smart Health IT platform, Smart on Fire. And many of you last year saw John Brownstein, that's probably his name. We got Peter right, we got John wrong. A lot of his analysis. So the winner is Boston Children's. And remarkably, although we've had a bunch of them here over the years, including John here last year and earlier this year in Boston at HXP Factory, there's no one from Boston Children's here. This shows that we really did run the voting up to this last weekend. They just corrected ahead right at the end. It was good to get somebody. But I was able to talk to Ken Mandel earlier today, so we're going to roll that video. And imagine this is like Lady Gaga winning the Emmys and she's in a hotel room in Rome.
Well, it's thrilling that we have the Global Retrospective 10th Anniversary Awards to help people know it. It's our 10th year, and we voted in 4 categories. Patient activists, healthcare companies, healthcare organizations, and healthcare interviewers. And we're thrilled that the winner for healthcare organizations is an organization that's done amazing work in health technology, as well as in caring for a lot of sick kids over the years. It's Boston Children's Hospital. So here is the award, and unfortunately, although we've had lots of folks from Boston Children's that helped him over the years, no one's here this year, but we've got Ken Mandel on video. Ken is the Professor of Biomedical Informatics and Pediatrics. His former title is the Director of the Computational Health Informatics Program. He's probably best known as the guy who runs SMART. So, Ken, thanks for joining us.
Terrific. Thank you, Matthew. This is really an unexpected and absolutely delightful surprise. I'm pleased to represent the organization, the work of many, many people. Health 2.0 has clearly been a tremendous mover and shaker in this field, and we couldn't be more thrilled than to be recognized at Health 2.0. As you know, Matthew, we've been working at Children's Hospital and in the Computational Health Informatics Program on trying to really transform the way patients are treated, the way diseases are characterized, the way healthcare works. One project that I know you've been very engaged with us on and attended many of our sessions and contributed to the thought leadership is the Smart Health IT project, where we're redefining interoperability in healthcare by building an apps gallery of substitutable apps that can run across healthcare. You know that we've also done a lot of work, not just for the individual patient, but also at the population level with projects like HealthMap and the use of social media and news feeds in defining infectious disease spread.
Fantastic work, and it's a thoroughly deserved award. I couldn't think of an organization that's done more on an individual level to push the whole field forward. So Ken, that was a 10-year retrospective. You've done a ton of the last 10 years. I assume you're not stopping. Can you give us a glimpse of what you think the next 10 years are going to do to Boston Children's and in fact the whole ecosystem?
Yeah, you know, it's really interesting. There's such a much more active field than it was when we began. It's thrilling to be a part of it, and being embedded in a healthcare organization, we really have the opportunity to use Boston Children's Hospital as a laboratory for informatics innovation. And we, in the next 10 years, hope to really use our tools to characterize patients, to redefine disease taxonomies, to impact the way the point of care operates for doctors and patients, to engage patients at home, and to characterize populations and diseases in populations as well. When I was in medical school, the departments on the quadrangle were anatomy and physiology, and now they're biomedical informatics and systems biology, and it's, I think we have an incredible opportunity to redefine the way healthcare is delivered.
Ken, thanks a lot for all your work. Many congratulations on running this community-sourced vote for the Health 10th Anniversary Global Retrospectives. We hope we're around in 20 years, and maybe we'll have you back then and see what in 10 years from now, or after 20 years, and we'll look forward to having you back then and see what you and your colleagues at Boston Children's have accomplished. But many thanks and congratulations.
Thank you so much, Matthew.
All right, quick round for Boston Children. Marin, thank you so much. All right. So